ডক্টর চক্রবর্তী, আপনি কি এসেছেন? ডক্টর চক্রবর্তী, am I audible? Good evening, Dr. Chakraborty.
Evening.
Am I audible?
Yes, audible.
Okay, okay. So after 5 minutes, we will start.
Okay, sure. Thank
Okay.
you.
Do you want to share your screen?
Yes, I require to share. Now only I'll check it once or.
I have already give the permission to you. No,
Yes,
no
yes.
issue.
Okay.
You can do it. Okay.
Okay.
You
Okay.
just keep your PPT on your desktop, as it will be help to easily get it.
Okay. Okay.
So we will start our today's session. It is the SAIARD Knowledge Sunday event, and today's lecture we are honored that we have get the lecture of Dr. Swati Nondi Chakraborty, HOD, Department of Life Science, Guru Nanak Institute of Pharmaceutical Science and Technology, Kolkata. She will deliver her lecture today on the issues, challenges, and issues of biomedical waste here. So, thank you, ma'am, for being with us. And on behalf of SAIARD, as a chairman of SAIARD, I would like to give a special thanks to you and all the participants, those who have joined today in our webinar session. And before we starting our session, I would like to say something about the SAIARD. That SAIARD, South Asian Institute for Advanced Research and Development, is basically a Government of India MSME certified academic institution, as well as we are also associated with the UNESCO Center for Peace and US Federation for doing activities, academic activities. Besides that, mostly we have developed several wings under the SAIARD, like SAIARD Research Council, SAIARD Research Incubation Center, Digital Learning Platform, SAIARD Youth Council Forum, World Youth Council Forum, along with the SAIARD Council for Business and Entrepreneurship Development. And these all activities we have developed particularly for to support the young entrepreneurs, particularly for the development their skills, not only for the students but also for the our faculties. Even through this platform, we have started this webinar session after this lockdown period. You know that from March we have getting this lockdown session, and from April we have started this Sunday webinar session, that is the Sunday Knowledge Sunday, and this program was so famous within a short span of time that up to we have booked up all the Sundays up to September. And today we are honored that we got the opportunity to hear from Dr. Swati Nondi Chakraborty, and she is a very good scholar, academician also, as well as scientist. And on behalf of SAIARD, once again, I would like to thank you, ma'am, congratulate you for being with us. So before we start our session, I would like to say something about this personality. Dr. Swati Nondi Chakraborty is right now, as I told, that she is the HOD in the Department of Life Science of Guru Nanak Institute of Pharmaceutical Science and Technology. Along with that, she is a distinction of having contribution of the being part of the growth of environment biotechnology. She has developed several databases that are first in respective categories. She is also member of different environmental committees of Chamber of Commerce, of research interest area. Her research interest area and area of specialization are mostly the environmental ecotoxicology, biotic and abiotic stress, bioabsorption, bioredemption, etc. Even carbon footprint. It's also an important, interesting part of my subject, and waste management too. So her research activities in the last few years have essentially been towards merging the theory and practice of sustainable development with special reference to wetland and e-waste management. She has published several peer-reviewed papers, particular the subject. Dr. Swati has research experience in renowned research institute like Indian Institute of Technology Kharagpur, IIT Kharagpur, Council of Agricultural Research, the Energy and Resource Institute, that is the TERI in New Delhi, and in different organizations. She has got awarded and honored by the theme speaker World Environment Day organized by NERI, National Environment Engineering Research Institute, on air pollution 2019. Besides that, she has got lots of projects. She has worked on lots of projects, and not only that, awarded by different awards. And we are very much honored that we got such personality today with us. And with that, I would like to share one more good thing to you, that we have already developed on behalf of SAIARD a news channel, online news channel, that is the YouTube channel, where you can find this live session will be there. And if you want to ask any question after this our lecture, you may ask. You will join with a discussion forum. And this YouTube news channel, that is the Maharshi News, is purely an academic and intellectual news channel where we have started lots of already getting lots of lectures, interviews by the different eminent personalities, not only from academicians but also administrators too. And after 15th August, mostly on 15th August, we will start this news channel. We are planning to start this news channel officially, and completely it will be an academic news channel. So anyway, with this, once again, I'm thanks to all the participants here to join with us, and I'm handing this microphone to Dr. Nondi, Dr. Chakraborty. So over to you, ma'am. Thank you.
Thank you, Dr. Chaudhary, for giving a opportunity to talk in this particular sessions of your Knowledge Sunday. And it is really a very nice opportunity to have with particular sessions with you and to interact with this particular area. And that like environment is a sector like where we need to work together. It's a kind of area like we cannot do it alone. So here it's really nice to get to know about the South Asian Institute of Advanced Research and Development have so many wings and so many activities, not only for the academicians and also for the students and the industries and also for the general people itself. So it is very nice to hear from you. And so we can start like today's presentations.
Yes, ma'am, you may start.
Okay.
And I would like to request every participant, please unmute yourself. Sorry, mute yourself, as that our program running smoothly.
So is it visible?
Yes, 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 completely. You keep it in a slide share mode. Yeah, fine.
Yes. So in these particular situations, as in a lockdown mode, so we know everyone that like situations what we are facing, like due to COVID-19, that is really from our busy schedule and situations where we are right now, that is very challenging to us. And so there are the theme of this particular talk I kept is challenges and issues of biomedical waste management. And as we know that this waste are not only generate this particular time of the COVID only, it is generated throughout the years. And now, especially this COVID time, we are very much conscious about this waste because this biomedical waste, or rather we can say about that COVID waste, is a very dangerous waste as it is very infectious. And we know if it is being seen that this due to this coronavirus pandemic, this particular new waste generations which has been occurred throughout the world, not only a particular I'm talking about the India or in narrow in West Bengal, it is throughout the world. It is taking the 10% of the COVID waste which is generated in a country per day. So if we consider that the what is the status of India, that where we are right now, so there is Delhi is the third largest generator of this kind of waste. And as this type of waste is not only is generating from the hospital itself or the quarantine center itself, it can be generated from the household, like where the particular isolation care, what we are known as a home care. So from there also this type of waste are generally can generate. And the general people, like we are using the particular mask and gloves for to protect ourselves from this virus, and that may carry like from asymptomatic carrier or from anywhere else that may carry this type of viruses. So it is so dangerous. So we need to aware with these particular things through these particular sessions. And here we are like we what we have seen that quantity of the healthcare waste which are produced in typically the developing country, it depends on a wide of factors that ranges zero point 0.5 to 2 kg per bed per day. Like see, like if we see the throughout the world, there is a number of hospitals. It is quite a lot of numbers, and there is the seat of the like the bed of the hospitals. Then from each bed, there are the generate this particular waste can generate. So like by giving this particular data, I try to get the particular things to draw your attentions that how much big it is. And there are the India generates as much as the data what I have received, that is the 500 tons of biomedical waste every day. And it is quite a lot, like the 500 tons. And there, if we see the other parts of the world, there are the Saudi Arabia, it produces only the 80 tons. So it is a daily manner what I'm trying to show you. This is the particular figure. And this biomedical waste, if we consider, there are the different types of things are comes under of this. There can be the different types of non-infectious agents or the waste. It is, you can consider it, it is only the most part of the waste. But if we see the particular graph itself, that is considering the 85% of the part is the non-infectious under the biomedical waste, which is a BMW according to report of WHO. But this pathological infectious part is so dangerous. It is mainly contain the different types of, suppose the gauze or the cottons or the blood carrying materials. So that can spread the infections in a 10% manner. And there are also the sharp objects like needles and all those things, the scissors. And there are also the chemical and different types of pharmaceutical waste are also comes under of this. So if we see this particular figure from the perspective of 2018, like it is not only the figure is changed in 2020, due to the COVID, like in 2018 also, like there also we are producing the biomedical waste, the different parts of the society from the hospitals. And there are, if we see the figure, there was a 20 metric ton. It is not less than the total waste which are generated. And there are also the, like the report, it is being shown that 550.9 tons, metric tons per day. This is the figure of the generations of biomedical waste from India. Now, if we see that according to the report of Central Pollution Control Board, the state-wise, there is a Delhi is generating the 11 tons of COVID-related waste. But other waste it is also there. So that is generally the 27 tons like that. And if we see the Mumbai, it is also just generating the 9 tons of the coronavirus related waste. And there are also the other parts. So like see the data, like how it is changing and how it is due to the COVID, the generations of waste, it is also increases. And here we are I'm trying to show you the figure and facts about that the different states, if we see that they are also generates in they are also the metropolitan city, and they are also generating the waste, and also the figure is also the disposals kind of area, if we see, are quite a difference are there. And there are the globally, if we see the data, it there also the particularly USA and Western Europes and India also generates the different types of waste. And here the biomedical waste generated per day in India in 2016, it was the 517 tons, and then in 608 tons that can be treated in 2018. So like that though, so these are the top line figures what we are getting through the through the different types of surveys what have been conducted through the different agencies. And they're the top line few facts which around a biomedical waste, the quantity and which breakdowns, how it is breaking down, and how the like what part of this biomedical waste have the danger. So it contains the different types of biohazardous waste, which can contain the different harmful microorganisms. Not only the COVID virus, there can be the associated factors is also being there. So we have to be that's why we have to be very concerned about this fact. And this is the rules and regulations part. What we know already that every BMW West comes under this particular rules of 2016, and then the amendment has come up on 2018 and 19. That we need to apply these rules to all the persons who generate or to collect or receives or store, transport, and treat and dispose or handle any biomedical waste. So each and every what have very important in present conditions, like suppose who are generate like the hospitals and all the centers who are dealing with the COVID patients. And the collections means that the who are collecting like the persons who are collecting the bloods, and the different tasting is still is going on in different parts of in Kolkata and also in India. And so there are also the receiving stores like there where we are keeping the this particular things like after uses, like where we are storing. So this part is very important, that how we are treating, how the transportations like from one particular area to like transporting those waste on a disposals area, and how it is being treated, how the particular thing is handling. So there's each and every part is very important and comes under the strict regulations of this BMW rules. And here the occupier means a person's having an administrative control over the institutions and the premises generating the biomedical waste. So responsibility to for the every occupier, like who are working on this particular laboratory, who are handling, who are storage, who are take care of the storing and the disposals of the total units. All everyone is will comes under these rules and the followers of these rules and regulations. So this untreated biomedical waste should not be mixed with the other waste. This is very important point, like the source segregations. In an environmental part of view, when we are doing any kind of work or we are applying in anything, so we are trying to get them, trying to see the nature of the waste. So that nature of the waste is totally like comes mixed up when it is comes like a from the municipal solid waste. So there we cannot able to segregate. We need to have a very conscious about this COVID waste and for this biomedical waste at a source segregations. And this biomedical waste shall be segregated into the containers or the bags. And we know that there are the different color coded bags which we are mainly applying for this particular purpose. And we need to use these particular bags for that. And this biomedical waste container or bag should be prominently labeled with a biohazard symbol. Like the suppose like in the time of handling, when it is passed on from one person to another person, they may not have the proper knowledge about the product or the things what we have on or what we put on that particular bag itself. So that level must be there, and there the rules has been mentioned over that on the packet itself, on the packaging, you need to write the disease and COVID waste like that, and you need to put the date and also the timing. Like that way you need to maintain the data, and this is the required fact. And there are also the untreated biomedical waste, and which must not be stored greater than 48 hours. And the spillage occurs during the handling. It is not at all bill considerable factors, like whenever we are handling any type of COVID waste. So before of that, the particular area must be sealed, and whatever the mopping and the things or work is going on. So we need to be very careful on taking care of that particular area. That should not generate the extra aerosols on that particular area. So it gives like it requires a specific training also on that particular like those the worker who are working on that sectors. And there the like we know that there are the particular app is being developed by the CPCB, that is the COVID-19 PWM. And here, all the CBWTF operators should register themselves to keep on data on a particular that how much is generating on a particular waste, or how it is being handled from the entering the data, or like how it is being generated or disposed of from a specific area. That should keep the records. And this is a like a container basis. There are the particular container color. You can see the different color which we already know this is being according to the BMW rules. Like we need to use the rate container for the infectious waste, like any kind of things which are being considered, which can be like treat after the autoclaving. So there are the facts what we know about this particular rate containers. And as this yellow container, we know this is a totally the COVID waste. What we know that there are the different types of the bloods and also human tissues, or the different like the placenta kind of things, or anything like which is can directly like cause this type of infections, that can be separated through this particular yellow bin. And there are also the sharp objects has been utilized in different hospitals, in different centers, like I have already discussed, like the needles and the scissors that must be kept separately. And like that way, there are the different color bags are being taking care of the different parts of the waste. So we need to segregate the waste or the biomedical waste, rather the COVID waste, on this manner. And this is very important part we should maintain on this area. And we know that in this particular seasons, we are using the PPE, and they're also generating the waste, like how we will dispose of all those things, and how infections will be carried forward. That is also a very like questions to ask. Like here, the inner disposable gloves, outer heavy duty gloves, or water resistant gown, and also the N95 mask, boots we are using in this particular time. The workers are mainly using those who are handling direct exposures on that particular vest. So this can be treated on this area. Like you see on the goggles and the face shields can be immersed in 0.5% of sodium hypochlorite for 10 minutes. And this is very important that we should maintain the percentage of the sodium hypochlorite and also the consistent of the time. And there are also the N95 and also the mask of like coveralls, which can be stored in the double bags. Like here also the BMW is mentioned about that double bag natures, like it should not be teared off, or it should be properly tied. Otherwise, it may spread any risk on that areas. And there are also the disposable PPE, which can be handed over to waste collection staffs. So we need to have a very good like systems, or it can be the automatic system or a particular auto connecting systems. They should take care of these particular things. And this very important point here, the second point, which is the mask and the gloves, which are used by the persons other than COVID-19 patients. So what are the guidelines we should maintain, or we should keep in paper bag for the minimum 72 hours to disposals of the same as general waste? So we need to follow these particular things as of the guidelines of the particular authorities of CPCP, and there we should cutting the same to prevent the use, obviously. So like that way we can like prevent the infections. And there are the definite These are the figures what I'm showing you here. The who are the main particular the risk, the greater risk is the exposed persons who get the exposures of this virus is more. They're obviously the sanitations workers and the environment, those who are working with these particular samples itself, and medical practitioners. They should follow all these guidelines very carefully, and patients and the public, those who are taking care of, like we know that in this particular time there are so many patients are being treated by keeping in home isolation care and all that, so they are also being take care on this particular guide. They should follow these particular guidelines itself. So this is the chart where we are seeing that this is the particular factors like in-house segregations, collections, and packaging can be done. And the common storage point at the hospital, then the transportations and unloading the transportations, and the treatment part we'll discuss later on. And the disclosures also we'll discuss. And there are the another important point which is comes through that, like which this particular waste, when we are talking about in any house in our hospitals or anything else, that also relates a particular water treatments, like what is a kind of risk associated with the like the STP plants or kind of areas. According to the WHO, there has been their mentioning that there are the very low risk of this particular virus to transmit through the water, but they are not saying about that this have not have any risk. So we need to be very cautious about our like STP plants, because whenever this type of water, the like treated water, like when it is being exposed to any environmental rivers or anything, any drainage or anywhere else, so it also can spread or have the chances, if it is not being treated properly, then it also have the chances to spread the viruses in the environment. So we also need to take care about that part too. So now the problems which are being also associated with this biomedical waste. So we are always talking about only this particular area of the COVID virus, but particular comorbid factors are also associated with this. There are the like different patients are being affected, or the different types of virus is also being present on the different samples itself. So we need to be very conscious in the time of handling of this biomedical waste. There are the chances of spreading the HIV to and the hepatitis viruses, and also the different bacteria, and also through the parasites. So now the issues, like what we are discussing, like these are the thing is being generated in the hospitals and also generates in different quarantine center what we are observing. But first issues what I consider, that is the adequate attentions is not given the throughout the world, I can say, and throughout the India in hospitals, the different parts of the hospital, like in the different sectors of West Bengal too. Like if we see, we are not able to visualize all those data, like how they are taking the attentions on this particular, because according to BMW rules, they must show this data, like how much the like waste is generating per day, and that is the issues also being concerned in present scenario. And there is an indiscriminate disposals, like we are still, and today itself, before going to give these presentations, one media was asking me that was an issue in Kolani hospitals. There are in a hospital area, there are particular uh, like mask and everything, and like is over there, who will take the responsibility? That hospital supers, they are not taking any responsibility that from where it comes and how it can be taken care of. So the people must be aware of this particular area, and they should come forward on this work itself. And the segregations are lacking, it's really a fact. And we are seeing that the hospital are working on that particular area, it's bit, but the household, when the isolation centers of the from that particular sectors, we are the people are not segregating well that particular things in a well manner. And there are also the particular recycling and the no treatment and the disposals facility is directly available on this particular area. So we need to be more see on these areas itself. And there are more training and awareness is also required. And as I said that this is a very, very important area, like the worker, those who are working with direct working with this waste itself, like the generators at the different part, the patients and the particular area where the things is generating. But the worker, those who are working with this area, if they are not concerned, if they are not properly trained, it will give a very devastating uh, things to us. And there are also the fund allocations, that is a different questions of discussions. And there are the lack of infrastructures in hospitals to tackle the problem of biomedical waste. So this is a very important part. Like we need to develop type of infrastructures and the automated infrastructures that can be handled. That there we can impose the different types of artificial intelligence kind of technological things. So there it can be no touch people of the things can be happen. So there are the different scopes of working on this particular sector itself. So there are the challenges are there. So there are the establishing the robust waste management policies within the healthcare facility and organization. So different state, different organizations working or handling the taking a waste in a different way, and they're trying to minimize the waste on their way of like seeing the things or treating the things or the carry forwards with the particular area. And organizations are required to wide awareness about the health hazards. So every organizations must have to give a digital awareness, like a campaigning on a particular sector itself, like where this type of work are going on. So when we enter the hospitals, there we are getting all the services, but after that, when the general like it's this biomedical waste part, like if you go on that particular sectors, if you see the particular sectors, so they should require the workers, those who are working on that, they should require the 24 into 7 hours that particular like awareness on that sectors, so that they can trained properly, they can do the things proper manner, they can handle the things in proper manner. So that ultimately will help you to monitor and control of waste disposals. And that clear responsibility and traceability for appropriating handling and the disposals of waste are very, very importantly it is required. And also the opportunities in medical waste management markets. As we know, there the waste generations, like I have shown you the data, like it is very high. So whenever we're talking about that waste, there the different components are there. So we can reuse from that particular components itself. So there are the scope of opportunity to get the different openings of the different markets over there. So there are the different types of plastics are also being used. So how that can be minimized or that can be reused for the different purposes, that can also be like work on that particular area. So there are the lots of opportunities are there to work on that area. So the growth of this market is mainly reliant on the increasing generations of waste. Obviously, I discussed about this. And not only the India, it is all throughout the world, it is generating on a high, like high rate. So we need to see about that factor. And there is the issues of environmental decontamination. So environmental decontaminations, where I try to mention on this particular area that this COVID-19 virus have very potentials and it can survive on the environment or for several hours or days. So it have the like a high potentiality to survive on the lively body on the life itself. So there are the risk of sustain on the different sectors, different surfaces. So we need to care about this, how we can decontaminate that particular surfaces and what are the way we can follow. So we know that sodium hypochlorite is very, very like kind of cleaning agents what we are using as an having the antimicrobial property as a disinfectant in everywhere else, but we should have proper knowledge in the time of using this particular chemical components. And whenever we're talking about that premises and areas is potentially contaminated with the virus, which to be cleaned before their reuse. This is very important part. Like suppose a particular room where the COVID patients is like is staying or have got like treated in a hospital. So it needs to be like very well, it should be clean. Not only the bed covers and everything, the parts, the curtains, the door floors, everything, every part of that rooms and that area has to be uh, comes under this decontamination process. And there obviously the accordingly the rules of BMW that use masks, tissues, head covers, shoe covers, and the disposable linen gowns, non-plastics and semi-plastics coveralls were to disposed in an yellow bag. And that should be meant under the incinerations process of CPWTF. And we know this kind of bags ultimately goes to the incinerators, and that has been like incinerated in high temperatures. So this the leftover food or the disposable plate is also can carry this COVID-19 virus itself. So we need to take care about that area too. And particularly the red bag, but we know that use the waste for contaminated plastic, such as the goggles and the splash-proof aprons, plastic overall, all hazmat shoes, and then gloves like that. And there are the things we need to follow in the time of cleaning surfaces in the process, like where we are touching the surface more. So that should be cleaned properly, and the low touch surfaces also be categorized on that area, that how we should like clean on that areas itself. It is mainly for the hospitals or the quarantine centers, like they should follow this kind of like things to be done on that area itself. So disinfections of high touch surface, like you what I have discussed about the doorknobs, like the telephones in every hospitals is there, and the call bells, stair rails, everything, every this part is can be accessible much more with the like it is more exposed areas for the like the humans when they enters they generally hold this particular area more, and that is also being frequently can be contaminated through this, and that should be cleaned 1 to 2 hourly, and that should be kept confirmed if there is any cases is being found, that should be repeatedly that should be cleaned in a day. And like that way there are the rules are being maintained in a different hospitals and different quarantine centers. And this is a particular statistics, but through the statistics I try to say you that there are the developed countries, they are generating 1 to 5 kgs per bed per day, with variations among the countries. Obviously, it is there, but in India, it generates 1 to 2 kg per bed per day, with the variations among the government and the private establishments. Obviously, it is there. So it's a huge quantity is generates, and these are the things we are used to see that how the hospitals are maintaining, but we have to maintain these things very strictly, and otherwise it may spread the different types of like not only the COVID, it also can spread the associate diseases to us, and COVID can also spread very rapidly if we are not maintain this type of practice. Then the treatment procedures, but we know that these are the biomedical waste treatment procedure generally follows, that is the incinerations. Like we generally say that that all the infectious medical waste are being disposed through the incinerations. And there are the different changing of rules are there in through the last like biomedical waste rules wise, that whenever the incinerations are being takes place, there are the different fumes are also generating. So they have also giving the guidelines to the particular authorities and the bodies, those who are taking care of the 50 beds, or based on that they are cannot allow to generate more than the particular regulations are there. So every authority has to be maintained in the time of incineration process, also that how much gaseous matter is also released in the environment. And also the autoclaving is a fact that we are doing generally saying that the steam sterilizations are being takes place for to remove out the infectious agents or the microorganisms, and microwaving also done, but it's generally the autoclaving are the normal process, and the chemical treatments has been also done. There's generally through the 70% alcohols and with or the sodium hypochlorite 0.5% or the 1% are generally used, and these are being also used to treat the like whenever we are traveling the waste when it's transferred from the from hospital to another area, whatever the containers or the floors or the traveling areas, everything is being disinfected by the 1% sodium hypochlorite. So these are the things that's being maintained, and there are the alternative treatment technologies are there to be focused, or we need to work on that particular area. Like there are the plasma gasifications methods are there, so we need to be focused, or we need to do the more work on that area. So I have already said this part, like there are the scope of working on this area is open nowadays. So I expect that students and all the researchers must focus on this particular area. So how that can be treated very easily, by treating or by not contaminating these areas too. Here I'm showing you a very small video, so you can see this, that how the process is really takes place. So what we have, like I'm trying to show you this through this video, like what can be done through this total models. This is a model projects from starting to generations of the west to the ending through the ATP plants. After that we can reuse it. So this can also have the opportunity to work on that areas, and there these are the standard precautions are should be followed, that we should manage the laundry part and also the hand hygienes, what already have discussed lots in everywhere else, and we have already know about this particular area, that how to maintain the environment and the management of blood and the bloody fluid parts, which should not give the spillage to anywhere else, or in can contaminate or should contaminate on the particular floors or anything anywhere else, or should not be contaminate to the environment too. So these are the main factors of this. So thank you for listening the whole presentations. And if you have any questions, you can ask me.
Thank you, madam, for sharing a wonderful lecture and a wonderful topic. And many things we have came to know from your lecture also. And right now, this is our question answer session and discussion sessions. So right now, from audience, you may ask any question. And already we got the feedback from your lecture of your lecture, that a very nice, informative lectures and all that. So thank you once again. And right now, this microphone is for to the participants. If you have any queries, you may ask to our honorable speaker. Please. Yes, Priyanka Singh. Yes, ma'am. You may ask.
Hello. Yes, Priyanka. Hello.
Miss Priyanka Singh, am I audible?
Hello.
Yes,
Hello.
you can ask me.
Good evening, ma'am. Ma'am, how can we spread this awareness to the local people, like the people who are not so active in social media, because they need to know this issue, because this is a very emerging problem, and many people use this marks and throw it away here and there. So, how can we spread awareness to them, to the
Uh,
normal public?
yes.
Before I'm just interrupting. Priyanka ma'am, please share your designation also. Whenever any part audience, whenever you have any question, you will ask any question. Then please share
Okay.
your name as well as designation. And
Okay.
Swati ma'am, can you
Yes,
slightly?
yeah, yes,
Uh,
it's audible. Yeah, fine.
okay, fine.
Sir, my name is Priyanka Singh, and currently I am doing masters in biotechnology from Guru
Okay,
Nanak Institute of Pharmaceutical Science and Technology.
okay.
Yes. Yes, Priyanka, you have asked a very good questions. Really, like we are mainly aware of this particular fact through the social media, through the studies. We know the dangerous things of or the infectious nature of this kind of viruses, and it's really a great problem for the workers. And in the time of giving the presentations, also I have mentioned so many times that we need to keep a special particular arrangements in every hospitals. We should keep it like they should know through the digitally that what are the things should be follow, and they should follow these things very minutely. But in the local level, the particularly urban local bodies are there, so we need to talk, or we need to engage the local peoples to the authority, those who look after on this particular area, urban or the rurally. so that who decides the policies for these particular things, and the kind of students or like you or the others who should come forwards on these areas. So through that the people must know that we should not do like that, or we should not. And there are the media like that plays a great roles, that everybody watching the TVs nowadays, they are having, everyone is having the mobile phones. Through that also they are accessing the things. So they must see that these are the parts which is very important, and this is to know or how to follow and how to take the care of these things. And I think that that should be the part we should discuss more with the audience, with the peoples. And when we are talking, we should discuss about the bad and good on that area, how to treat, how to handle, and how to take care of these areas. That can be care.
Thank you, ma'am. Okay, ma'am.
Any question from any participants? Please ask. So really, ma'am, it's a very good topic you have developed, generate, and you have research. I think you have also research on that. And
Yes,
one more thing I would like to know that that entrepreneurship is right now. My research topic is particularly to generate entrepreneurship and startups. So how this model, that is the biomedical waste management, it's a model,
yes,
can be a part of entrepreneurship development or
yes.
startup industry. How it can help in startup industry.
Yes, it is a great opportunity. Like I have shown you a specific a model of like how they are working. If you do start finding out or do survey on this particular area itself, start working on this area itself from West Bengal itself, or you can rather start working with this Kolkata itself, that how many hospitals are aware of this fact, or how they are maintaining this fact, like the treating procedure. Then you can get the real pictures, and then you can find out the loop and holes of that areas. And then you can start working part by part on that sector itself. And there are the great opportunities to work on, or to develop, or to generate the entrepreneurships on these sectors. So there are lots of scopes to develop, like the design part is a different part. Like here I have shown you the semi automations, that how the process is going on, but it can be done on the through putting the artificial intelligences on these particular areas, that how much our waste is generating, and based on that, that will be segregated, or that will be separated. So now the system should come forward where no man touching, so people will less touch with this particular infectious agent. So that can also be developed. So there are the coordinations are required, and the team should be required, and think generations team should work on behind of this. So I think it can be done. This is a very good area to work on.
Because you have also you have a lots of students with and in that case you also can motivate your students regarding this, because there are lots of opportunities, I think, because it's a one kind of management system. And even one more thing I would like to know, that we have know about the technology, that is the geospatial technology, GIS technology. So in that case, how the GIS technology can be useful to manage this biomedical waste.
Exactly. There are the lots of parts are there. Not only the I'm not being able to the efficient person on the JS technology. There are the so many parts of the designing part is also there. What I have already mentioned. But the thing is that there are the simulations. What like they're the part of the laboratories, that how things can be divided, and what are the source segregations, how the things can be modified, how the design part can be more improved on that way. So we can start working on that part also. And now from this part to there also a part is there, the ETP treatment plants.
Hmm.
The we are just ignoring, like we are ignoring in
Full
case
form,
of
what is the full form of EPP?
like that is effluent treatment plants.
Okay.
Like any industry, they should maintain the effluent treatment treated properly. They should maintain the effluent properly before exposing that particular materials into the environment. So like in case of the industry, they are not at all get the permissions if they not follow the proper ETP rules. But when we are talking about the specifically the industry like of this hospitals and that kind of, there are some bit of reluctance is there. So, but it is an important point to maintain over there, because we are not having that much very strict policy on that area. So we are mainly skipping on that area to work on. So we need to work on this area more. It is
Okay.
also have a very prone chances to spreading the diseases if we not treated the things properly, if we not taking care of the things properly.
So, in case of Indian status, Indian scenario, or in case of West Bengal scenario, so how far it has been applied, or it was in application field, how far it was maintained?
Like which one? Like,
Biomedical waste management.
yes, it is very truly. If I'm saying you, this is a very like when I have start working on this particular area, there are the very less figure and facts is being visible. Like it is the rules of the Sanitation Control Board that you need to give the data to the website, and the public should know about that facts and figures. And if you touch on these facts, you will not get that data very clearly, that how much the per hospital is generating the waste per
Yeah,
day,
it's a
and
major
how
problem. Yeah, how much the waste has been generated.
exactly. And there are also so many issues there. So that also being very difficult to handle on this particular area. But we should focus, or we should do on a, because we have a lots of hospitals which are in the private sectors and we are in the government sector. So like it should be a collaborative work should be required. Like otherwise this problem cannot be coming out.
Yeah. So in that case, how far the government will you want to say that the government should take an initiative to collaborate with the academic institutions, even researchers, for the better results in case of biomedical waste management also, because you are also working on that particular field. And suppose our organization, we are mostly focusing on geoinformatics related activities in technological part also.
Okay, okay.
And also we are working on that data management, this type of activity. We are soon we are going to start blockchain related courses and all that.
Okay,
So in
okay.
that case, it will be better that right now it's very important issue that government should come with academic institutions and
Exactly.
an industry academia collaboration, because through this industry can get an opportunity to generate new industry, because mostly are
Exactly.
entrepreneurs. And
Exactly.
here I know that I see that there are several students are there also joined here. And I am also as a faculty, I would always try to say my student to focus on entrepreneurship development
Yeah,
facilities.
that should be there. Actually,
Yeah.
student must feel they should come forward with that interest, with that work, with that innovations, and
Yes.
that is required field. And there are the lots of area where we can work on. And first thing is that the theoretically the survey part is very important. Like we need to get the real data, and
Mm.
that is a very required point to work on any specific area to start working. So in
So
West Bengal.
have you think about to bring any project on that particular topic from either central or state government, as that we can properly map and properly manage the biomedical waste, the number of waste generated.
Yes, I have interest to work on, so we can talk it later on. So we can draw any projects on that
Sure.
particular area. Sure, it can
Because
be.
in that case we can
Yeah,
also generate some activity, collaborative
yeah,
activities.
sure, that can be done.
So I saw that several professors are there. Dr. Raju Rupavate, he is a very close friend of mine. He is from Mumbai University.
Okay.
Raju Rupavate, sir.
Yes,
Good
sir.
evening. Good evening, sir.
Good evening, sir.
Good
Sir,
evening.
Dr. Swati Nandi, ma'am, I think that you have known about her. I have already told. So, have you any questions, sir? You are also geography faculty. Have you any questions to our Dr. Chakraborty, ma'am, regarding this waste management? Am I audible, sir?
Yes, you are audible.
Rupavati, sir?
Audible, sir. Audible. No question.
Okay, no question. So, and Dr. Ajay Kumar Tiwari, sir. I saw, sir, good evening. Ajay Kumar Tiwari, sir, good evening. Sir, please
Good
unmute
evening.
yourself. Unmute yourself.
No question, sir.
Okay. So, ma'am, I think today we have to sum up our session.
Okay.
And one more thing I would like to inform all of you that on behalf of SAIARD, we are going to organize one environment summit in collaboration with the UNESCO Center for Peace. And there, this topic we have kept as a subtopic, and there are 50 countries will associate with us for this conference. And also, we are planning to work on that particular field, and I will definitely discuss with you regarding that. And those who wants to join here in later and wants to hear the lecture of Dr. Swati Chakraborty ma'am, they can easily go to our YouTube channel, that is the SAIARD Maharshi News channel. Uh, Here, there they can easily got informations and all the lectures, and they can easily avail. So with this, once again, I would like to give you a special thanks, ma'am, for joining with us. Hope we will get your assistance in future also.
Okay, thank you, sir.
Thank you. Namaskar.
Thank you, sir. Thank you, ma'am.
Thank you.